Hi, I'm Brittany Montez, and this is the Orlando Health News Review for March 15th. Recently, we reunited two friends on the hospital unit where they first met. One, an Orlando Health team member, and one, a patient here, where they bonded over their love of running. You can watch their emotional story now on Swift.
I had lost all hope. It was 3 weeks from race day when I was in the hospital here, and it was devastating to me to know that I was not going to be able to run, and I didn't know if I was ever going to be able to run again.
I knew her hopes, and I knew she had already run Boston before, and I told her we're going to run Boston together.
And so in 2021, we ran Boston together, and it was amazing.
She's like one of the strongest people I know. It's amazing. I love her so much. You're so sweet.
And last weekend, Grow Mama, a celebration held for pregnant and postpartum women enrolled in the Orlando Health Maternal Telehealth Program, was held in Orlando. This program is funded by the Severe Maternal Morbidity Telehealth Close the Gap grant that was awarded to Orlando Health Winnie Palmer Hospital by the Florida Department of Health.
What this event is really recognizing is the hard work of all of our community partners and of our patients. So about a year ago, the Florida Department of Health put out what's called a request for applications. And the title of this grant is to reduce racial and ethnic health disparities in severe maternal morbidity. So severe maternal morbidity means really severe outcomes of pregnancy. And the goal of this was to do this work through the telehealth platform and really be able to have visits not only postpartum and not just with the hypertensive moms, but with any mom who was at risk for having a poor outcome. We had an enormous number of community partners that really have helped us help with things like lack of housing, lack of food, food insecurity, transportation, I can't get my medications, I need help with childcare, all those things. Through our partners and through the work that the teams also do at Winnie Palmer, we've been able to really help close that gap. We have recruited over 1,100 women into this grant. Today, we probably recruited another 50. So it's really been just a great opportunity to celebrate, to continue the good work we're doing, and then just to kind of thank everybody.
And here's Thibaut van Marcke, who spoke to a team member recently about well-being.
We started this program because really trying to recognize how challenging and stressful healthcare can be, and we want our team members to take good care of themselves so that they can take great care of our patients and be their best version of themselves.
Absolutely. I would say that accountability helps for sure. With the LifeWorks program, I was able to get in touch with one of the health coaches. They're very empathetic, and they definitely work with you to be able to help you make your long-term goals into little miniature goals. That way it's easier and more attainable. Also, I take advantage of Active and Fit, which is a program that's really awesome, by the way, and you can sign up for fitness classes, and you can have access to so many different gyms in the area. And then lastly, I like to meditate.
Nice.
So that is something that definitely calms me and helps release stress and anxiety.
Well, I'm so glad you had the opportunity to share with us a little bit about your experience with it. And for our team members, we have 8 months to go in the year where we'll continue to have opportunities to invest in ourselves and take good care of ourselves so that we can take better care of each other and our families, our loved ones, and our patients. So thanks for all that you do. And Tiffany, thanks for joining me today and sharing your story. And we'll look forward to more to come.
And the 2023 Florida State Legislative Session is underway, and Orlando Health's Government Affairs and Public Policy team is closely monitoring the session for any bills that may impact Orlando Health's operations and strategic goals. We talked to Zach Hoover, who's been on site in Tallahassee, to learn more.
Healthcare delivery and government are inextricably connected, whether it's the way government funds healthcare or the regulations of how healthcare clinicians can operate. So we try to advocate for Orlando Health, for our clinicians, and for our patients. The Florida State Legislative Session for 2023 just began last week, and the legislature meets for 60 days every year. That's the only opportunity that they have to pass new laws affecting Florida's healthcare delivery system. So we spend a lot of time up in Tallahassee meeting with legislators and walking the halls just to monitor for any bills that might impact Orlando Health and the way that our clinicians provide care to our patients. If team team members are approached about advocating for public policy in Tallahassee, please contact the Government Affairs and Public Policy team. We'll be able to point you in the right direction, connect you with legislators, and make sure you're being an effective advocate on behalf of Orlando Health.
And to recognize Colon Cancer Awareness Month, Orlando Health held an event for team members to learn about how to prevent the third leading cause of cancer.
With the exhibit, it has helped to promote awareness on education on colon cancer and how we can prevent it. Diet is a huge thing, so we'll have information too on diet, offer different resources here, education, support systems. Our goal is the care coordination, support, and education. We help the patient understand a clarity of their care to make it very efficient to help people get the screenings they need or any questions that they may have.
Well, that's it for today's edition of the Orlando Health News Review. We'll see you next week.